Some pets walk into the vet healthy and never walk out the same again. Today, I expose the science behind why Librela and Solensia destroy some animals from the inside out, and what you must do if your pet is already suffering. Some pets tolerate Librela or Solensia with mild issues. Others collapse into organ failure, neurological decline, autoimmune destruction, or sudden death. Why? Because these drugs target nerve growth factor, NGF, a molecule that does far more than regulate pain. NGF is a master survival protein for kidneys, liver, immune cells, blood vessels, neurons, bone remodeling, inflammation resolution, tissue repair. When you block NGF long-term, you don't just reduce pain, you disable the body's repair system. And in vulnerable pets, this becomes catastrophic. The science. How NGF blockade can kill. NGF is essential for organ survival. NGF keeps kidneys and liver cells alive under stress. Blocking NGF can accelerate kidney ischemia, liver inflammation, reduced blood flow to organs, cell death during normal aging. Older pets, especially those with silent early disease, can crash fast. NGF regulates immune balance. NGF is required for T cell activation, macrophage function, anti-inflammatory signaling, tissue repair after injury. Blocked NGF, and the immune system becomes confused, weak, and overreactive, which explains sudden autoimmune anemia, platelet destruction, severe infections, chronic inflammation spiraling out of control. NGF protects nerves. Without NGF, neurons degenerate, misfire, lose control of organs, fail to regulate heart rate, digestion, and bladder function, which leads to collapse, seizure-like episodes, hind-end paralysis, loss of bowel bladder control. NGF is required for bone and joint repair. Ironically, the arthritis drug can accelerate joint destruction, cause microfractures, trigger bone necrosis, increase pain once the drug wears off. This is documented in the failed human anti-NGF trials. Why some pets die instantly. Pets with hidden kidney disease, liver compromise, chronic inflammation, autoimmune tendencies, senior immune decline, and they can experience acute organ collapse once NGF is blocked. Their bodies simply cannot compensate. Why other pets suffer slow internal damage. In many pets, NGF blockade causes progressive organ stress, chronic inflammation, worsening anemia, muscle wasting, neurological decline, loss of appetite, GI shutdown. This is why owners say, "My pet aged 10 years and 2 months, because biologically they did. Why some pets survive and others don't. Genetics. Some animals have robust NGF-independent pathways. Others rely heavily on NGF for organ stability. Age. Seniors depend on NGF more because their repair systems are already weakened. Pre-existing disease. Even mild kidney or liver compromise makes NGF blockade dangerous. Immune profile. Pets with autoimmune tendencies can spiral into fatal immune collapse. Dose stacking. Monthly injections accumulate. NGF blockade deepens with each dose. How to help pets who are suffering. This is not medical advice, but these are scientifically grounded support strategies owners can discuss with their vets. Support the liver. The liver is heavily NGF dependent. Ask your vet about same, milk thistle, denamarin, Low-fat, high-quality protein diet support the kidneys. NGF blockade reduces renal blood flow. Discuss subcutaneous fluids. Kidney-friendly diet. Omega-3s. Phosphate binders if needed. Reduce systemic inflammation. Chronic inflammation worsens NGF blockade damage. Discuss omega-3 EPHA, curcumin, antioxidants, gentle mobility support, protect the gut. Many pets develop GI shutdown. Consider probiotics, slippery elm, easily digestible food, anti-nausea meds if prescribed. Monitor blood work every 2 to 4 weeks. Look for rising kidney values, liver enzyme spikes, falling red blood cells, falling platelets, rising inflammatory markers. Stop further injections immediately. If symptoms appear, do not continue NGF blockade. Document everything. Owners worldwide are building evidence regulators refuse to acknowledge. Librela and Solensia are not miracle drugs. They are powerful, immune-modifying biologics that interfere with one of the body's most essential survival molecules. Some pets tolerate that. Others pay the ultimate price. Your story matters. Your pet matters. And the truth matters.